Hey everyone, thank you for coming. We're just going to wait for people to log in and we'll get started in just a couple minutes. I'm just going to wait a few more seconds to get people logged in and then we'll get started. Okay, we're going to go ahead and get started. Welcome everybody, and thank you so much for joining us today. I am super excited to hear from our panelists about how health departments, community organizations, and schools can collectively work together to ensure equitable access to COVID-19 vaccines for refugee, immigrant, and migrant communities. My name is Sarita Wilkins, and I am the Communications Strategist for the National Resource Center for Refugees, Immigrants, and Migrants, or NRC-RIM. We are co-hosting this webinar today along with our partners at the International Rescue Committee, and I am serving as your moderator and MC. So I worked in public education for 10 years before I came over to public health. So this is a topic that is near and dear to my heart. Schools always have played a key role in community health and safety, and the importance of schools to our communities have been especially present during the pandemic. So before I get started, I just want to share a few housekeeping items. Firstly, the session is being recorded and it's being live streamed on Facebook. I will email the recording to all the participants later today. In that email, you'll also receive a link to a feedback survey, as well as links to resources on our website that support organizations who are looking to partner with schools. And then if you have questions for our panelists, please either drop them in the chat or use the Q&A function within the Zoom apps. We're going to have time at the end to answer any questions. If we could go to the next slide. I'm just going to quickly introduce our panelists. Suad Ali is a graduate research assistant at Georgia State University's Prevention Research Center, connecting behavioral science to COVID-19 vaccine demand. Her work focuses on increasing vaccine confidence in Clarkston, Georgia, which has a large refugee and immigrant population. She's a longtime advocate for refugee, immigrant, and migrant communities, as well as a small business owner, a volunteer, and a Master of Public Health graduate student focusing on health promotion and behavior. Next, I'll introduce Dr. Omar Aziz. He first came to Georgia through the U.S. Refugee Resettlement Program in 2013 with his wife and 2 children, after living in Dubai for more than 12 years. Now a naturalized U.S. citizen, Dr. Aziz currently serves as the IRC and Atlanta's Community Health Response Program Manager. To date, Dr. Aziz and his team, which is composed entirely of refugee and immigrant community members, they've vaccinated more than 18,000, they've provided more than 18,000 vaccine doses and more than 16,000 COVID-19 tests. Now, Stephanie Brown Bryant, or Principal BB for short, she has served as an educator for 25 years and has received several accolades for her work. Currently, she is the principal at Indian Creek Elementary in Clarkston, Georgia. Her leadership at Indian Creek Elementary prepares approximately 1,000 students to be college and career ready through enriching and engaging educational opportunities. Principal Beebe believes education removes barriers and provides hope, and it is her privilege to help build our collective future by providing a nurturing, quality education for students. Last but not least is Temple Moore. She manages the Community Health Promotion Program of the Refugee Women's Network based in Atlanta, Georgia. She's designed and implemented psychosocial programming and participatory research with displaced persons in national and international contexts, including working with unaccompanied minors and adults via first response, evaluation, and academic research and writing. Her interest is in combining trauma-informed occupational therapy with public health research, innovative programming, and storytelling for refugees and other vulnerable populations. So welcome to these four great leaders. I will now pass it along to Suad, who will get us started with a bit of background about Clarkston.
Hi, everyone. I'm Suad, and thank you so much for giving us the opportunity to be here today. I currently work on the COVID supplement grant along with 5 other vaccine ambassadors who navigate within the community to increase vaccine confidence and uptake in Clarkston, Georgia. So I just wanted to give you guys a quick overview of this lovely community we currently serve. So Clarkston is a very small city. It's approximately 1 square mile where residents can literally get out of their apartments and walk to school, the grocery store, place of worship, and shops. It has a relatively close proximity to Atlanta and convenient access to public transportation, which is really one of the main reasons why it's been a welcoming home to thousands of refugees since the 1970s. So it's considered the most diverse square mile in America. And I think for many immigrants, regardless of whether they move away or not, Clarkston will always be a place they consider home and a place that you just want to come back to. So approximately half of the residents here are foreign born and the other half are African Americans, and it has been nicknamed the Ellis Island of the South. Okay, I think Omar, you're probably next.
Good afternoon, everyone. Thank you for having us today. My name is Omar Aziz. I'm the Community Health Response Manager with IRC Atlanta and one of the Operation Manager with CORE. So the IRC, International Rescue Committee, and CORE, Community Organized Relief Efforts, had an existing relationship through working together overseas as an international organization. So once the pandemic hit, in the spring of 2020, Georgia-based staff from both organizations initiated a mobile team that's culturally and linguistically responsive to the community and responsive to the pandemic in Dekalb County. So CORE brought the resources and the infrastructure, and IRC brought the trust from the community, as the IRC has worked in Dekalb County for more than 40 years. So CORE is Community Organized Relief Efforts. So the partnership started between these organizations and the Dekalb County Board of Health to serve the underserved area and the communities in Dekalb County, especially refugees and immigrants with COVID-19 tests and later with COVID-19 vaccine. We focused on overcoming the main barriers to accessing the health services for these communities, which are language, culture, and transportation. So we hired a team of 18 associates who are from the refugee and the immigrant community and speak 20 languages. So this team helped to overcome these barriers and build trust on the community, which allowed us to reach community members that the traditional medical community may not reach as effectively. So the refugee and immigrant community in Dekalb County has received special efforts, including mobile vaccine and testing sites in apartment complexes, places of worship, on-site interpreters, and food distribution event to increase the number of the vaccine residents. So the team the mobile response team provided over 16,000 COVID-19 tests. So far across 2021 and 2022, we have provided over 18,000 vaccine doses. Thank you. I'm handing off to our partner, the Refugee Women Network, Temple. Thank you.
Hi, good afternoon or good morning to some of you. My name is Temple and I work at Refugee Women's Network, managing the Community Health Promotion Program, and I also co-chair the Clarkston Health Equity Coalition, where a lot of these efforts have started. And like Omar and Suad said, there's a foundation of trust that underlies a lot of the efficacy of these efforts to promote vaccine confidence in RIM communities. Barriers in Clarkston have been being addressed by a lot of community partners for decades, which really gave the community an opportunity to respond in a great way during the pandemic. Clarkston's Social Vulnerability Index is among the top 8% in the US. So you see high rates of uninsured population, high rates of food insecurity, housing insecurity, and a lack of living wage jobs. We see, like Omar also said, our typical barriers being transportation, language, financial situation, health literacy, and childcare. And large communities that live in Clarkston right now are from Afghanistan, Burma, Iraq, Iran, Syria, Congo, Ethiopia, Eritrea, Somalia, Rohingya communities, Kurdistan, Central and South America. So although there are a lot of barriers, when it came to responding to the pandemic, we, as different community leaders, organizations that were very grassroots all the way to academic and even international, needed to come together to show up for this community. We knew things that already worked in this community. We knew that we needed to be culturally and linguistically responsive. We needed to make the idea of testing and then vaccination understood by different communities, and that took what we often see, the community health worker model. So Refugee Women's Network, Georgia State, and IRC and other partners use community health worker models because these are people that are from the community, that live and understand the community. Those become our bridge to health and our bridge to really creating an impact within the Clarkston community. Next slide, please. So about a year ago, we formed a coalition of over 30 nonprofit, public, corporate, and academic partners. We meet weekly, and we started to talk about what our different organizations were doing to promote vaccine confidence and how we could work together and pool resources to really be able to increase vaccination uptake in RIM and other marginalized communities of our county and Clarkston in particular. Next slide. This is very recent data that shows in blue how Clarkston compares to other areas. First, other areas with a similar social vulnerability index, we are at 74% vaccinated compared to 66%. Then we've got a higher percentage exceeding the rate in Dekalb County, our local county, as well as our state. This is really an amazing factor, amazing evidence of what it means to have community partnerships be able to show up for organizations with such vulnerability, that we have such a high level of vaccination. Has to do with a lot of different factors, but what we are talking about here today is really those community partnerships and collaboration. Next slide. So once the pediatric vaccine became available, the coalition had worked together to do different things like virtual town halls, in language-specific workshops, health fairs that had over 30 organizations at each, all of which were centered on the dignity of the community being in the center and acknowledging in those barriers, and really showing up for different communities in different ways so that they understood the importance of the vaccine. And again, when the pediatric vaccine became available, we looked to one organization we hadn't included yet in the coalition, the schools, which is really every community's most trusted institution. It was really central that we partner with the schools of Clarkston to be able to increase vaccination. And we were really lucky that we had such receptive, passionate principals to partner with us in the coalition. We worked with the principals to get the school district approval, and that was the start of our Be a Superhero vaccine events. Next slide. So we came up with a superhero theme. This was something we found would be really accessible. We wanted to encourage the kids and kind of distract them from the fear of getting a shot while also making it really fun. So we were, like we said, we had, from the coalition, we split and had separate meetings just for these school vaccine events where we were bringing in people, superintendents, people from the district, people from Dekalb County, so that we could support these events. Next slide. So we did things like coming up with flyers. We had webinars for specific to the parents of these schools so they could ask questions before the vaccine events. We had a TikTok social media marketing campaign. You'll see a bit in a minute. And we did other outreach that was crucial to us getting support. During the event, we made sure that we had that community health worker model, the fact sheets, and all education in many different languages, which is something we do at all of our community health events. And we had the incentive from Dekalb County of $100 for anyone that got the shot, whichever shot it was, would get $100, which that really shows how we needed to show up for that financial need of a lot of our families. Kids that got the shot got gift bags. We had a fun zone with prizes. We had volunteers, including a county commissioner dress up as a superhero. And we also had photo stations. And next slide, you'll see some photos of that. So these are some of the things that were in the gift bags. And that included coloring books and crayons, lollipops, masks, pens, things like that. Next slide. And this was a typical, the different stations we had at each of the events. So again, we have the fact sheets, fun areas for photos, the area for incentives, and we also had additional services coming in. So different community partners that came in to offer other information and other areas of access points for health services. So we're not just looking at, shots in arms, meeting a quota. We really, again, the foundation of this coalition is health equity for this community. So even now we are slowly bringing in more and more health services to these events because we care we care beyond the pandemic. So next slide, please. Here's some more of the spirit that was brought to these events. Great volunteers brought in from different academic institutions. Next slide. And then I will pass it back to Dr. Omar. Thank you so much for your time.
Thank you, Temple. So in this slide, I will go over the most important steps from the clinical logistic aspect. So when planning a vaccine event at the school, we began communication with the principal to plan the webinar and the vaccine event. Weekly meetings with the principal are scheduled on a weekly basis to go over the planning, logistic, and the needs. After that, we decided to get the approval date for the event, and then the site developer visit the school to create the site map according to the protocol of the safety. After that, we discussed the language capacity, and then the type of the vaccine, and then the vaccination time. After we agreed to all of that, a specific link for the registration is created for the school. Then the consent form shared with the principal, and then we define the capacity and determine if it's a closed event or an open event to the public. And if we decided to make it an open event to the public, so we have to plan the process for the walk-up to ensure the safety. After that, the site map and specific request will share with the team and share with the team to make sure that we cover all the requests. So everyone will be at the same page. After that, we determine how many team members are assigned to the site. So at each school event, usually we have a site manager, registration team, operation manager, safety team, site developer, clinician, and the clinical manager. Can you play the video, please? So the registration team, so once the family arrive to the school, they will do a check-in at the front. And they will show a card we call the pre-registration card with the name, with the family size and appointment. And according to that, they will let them into the school. After that, they will line up and and we are following all the social distances and to make sure everybody has mask. Then the registration team verifies the consent form and make sure it's completed, and then provided them with the wristband depending on the vaccine type. After that, the team will walk them to the vaccination area, and they hand off the vaccine card to the clinical manager. And then the clinical manager will assign them to the right table because each nurse has a specific type of vaccine. And the clinical manager is there to answer all the medical questions and just to make sure and to make sure that everything is correct. Then the nurse will go again and verify all the information. After that, they will administer the shot. And then they will walk to the other table to get their gift card and then to get any information they want according to their language, like the vaccine facts, what they have to do after the vaccination, and they will get it according to their preferred language. After that, they will get their gift that Temple explained about it. And then they will walk to the observation area where is the games, and they will wait there for 15 to 30 minutes. Usually the registration takes 10 minutes, and then the vaccination 5 minutes, and then the observation 15 to 30 minutes, depending on the medical condition. Now I will hand it off to our champion, Principal Bibi. Thank you.
Good afternoon. My name is Stephanie Brown Bryant, and I'm the proud principal of Indian Creek Elementary School. First, I would like to thank you all for including us in this wonderful presentation, as we're so proud of our work and happy to share our results and our efforts. If you would not mind, you can please focus your attention on the video and we'll discuss later. Hello, I'm Stephanie Brown Bryant, the proud principal of Indian Creek Elementary School. We work hard to keep you safe. During the day, I'm your principal, but I'm also a superhero, and you can be a superhero too. Superheroes wear masks and get vaxxed. Be a superhero. I hope you got a kick out of that. I do not wear the superhero costume every day at work. I do not wear that. But that was just a part of our campaign to get students excited and interested, as it was a multi-layered approach for all of our students and our families to really understand how important it was to be vaccinated and to remove some of the fear, really, about getting vaccinated. So I came upon this wonderful group by means of one of our staff members who is a beautiful champion for our community and shared some of the efforts that were going on in the community. It was very difficult leading during the beginning of the pandemic because we really just did not know what it would look like for our schools. And we had people who were sick and dying in our community. Because of that, I knew that eventually we would be back in the schoolhouses. And also we were able to see inside every home with the cameras. We had Chromebooks, and we could see some of the suffering and how COVID was impacting our children. So we decided to join in on the coalition and develop some means to get our children vaccinated once we came back face to face. So the organization of it, Indian Creek is a very diverse population, as spoken before. You know, when you tell people you're in a refugee population or that you have a lot of EL students, they typically think of a large Hispanic population. However, my primary language is Burmese. Most of my children come from Myanmar. And our top population or languages for our population are Burmese, Nepali, Amharic, Karen, Swahili, Tigrinya, Dari, Pashto, Farsi, and a couple more dialects. Of the children, of the 900 children we have, 720 of them are from homes where they speak another language and they are refugees. So our challenges are pretty vast because you first have to remove the language barrier. We agreed that our trust, the trust in the community really is strong with the school. And we decided to include our interpreters as a large part of our process. Our parent liaison alone speaks 5 languages. So I've had her as well as our school interpreters, which we have a rotation of interpreters to schedule appointments. And I did bring some artifacts for you, if you can see. So we developed these cards that were shown in the video. And for the first vaccination, we needed we gave them 2, so they received 2 of these, and we gave 1 to the parent, and we kept 1. And that was important because if you notice, it has a family. They had to come as a family. And how that helped, what I thought as a principal would be great is if you get the whole family vaccinated, then you don't have to worry as much about the whole family getting sick. So that's why we made sure to include as many family members in each vaccination event. And once the parents arrived with their card, they presented 1 card, and then we matched it with ours, and they were given a specific number. This also helped us with a safety measure as people who heard about it in the community, because we really do have a village here, that the word would get out that we are having vaccinations with a $100 incentive. And we kept it local, but of course, family members or people who lived in the community that did not have children in school, found out about it, and they showed up. And all we had to do was ask, do you have your green card or your yellow card? And it's a different color for each date. So our upcoming date, which is the 7th, will have an orange card. And if they were unable to present that card, we knew that they had not pre-registered, and we were able to give them locations of other places where they could get the vaccination, just not in the schoolhouse. And another piece of security is we had great discussions about the amount of people coming inside the building and even contact tracing. And thank goodness the team, everyone really understood and pivoted on some of the regular protocols that we have in our schoolhouse, and they were able to comply so that, the families who are used to being in the school did not feel intimidated. They felt very comfortable, and we did not have to worry about strangers who did not understand our protocols about them coming in the schoolhouse. I'm most proud of this partnership because we have really provided some support and actually shed light on a lot of disparate conditions of our students. And it's really led me as a leader to branch out with other health concerns because of the pandemic unveiled for us or revealed for us. So I would really like to, as a leader, give pause to any other leaders or any other schools that are considering this is such a great event, such a great opportunity to continue to do this. And as a matter of fact, our schools, and we have one sister school who joined with us, and we have 2 others who have events this Saturday. And as of today, we have 974 vaccinations, with more than half of them being pediatric vaccinations. Now, what does that mean to me? That means that in my schoolhouse, either the children who are here or their siblings at home who are 5, well, actually our children, because they're 5, that they're vaccinated. And that is important because children miss less days of school. Their families are healthy and better able to take care of them. And the $100 incentive gave parents some security if they had to take off work or if they were afraid their children would be sick. It really did help us with our efforts. We also, of course, had boosters to come. And we have, with those 3, at each event, Indian Creek has had up to no less than 275 people. And I think we got close to 350 during the second one. And we're slated to have about 300 participants for our final event in May. So with that, I would like to say again, thank you. And we would like to leave you with a video of Eva, one of our students in the district. And you can share her experience in getting the vaccination at one of our events. Thank you.
Are you excited to get the vaccine today?
I am.
Oh my God.
We're all done. I did it. I didn't feel anything.
You did great.
Took a shot.
Good boy. Good boy.
I got vaccinated and I got powers. You can too.
Oh my gosh, Eva. Oh, that's incredible. Okay, well, we're about to get to our Q&A, but first I just want to let you know, if you liked this presentation, they're going to do a whole workshop on their school partnerships at the North American Refugee Health Conference in June. That's being held in Atlanta. I'll send information to everyone by email afterwards. And I'm also going to, in case people need to drop off early, I'll just put a link to a feedback survey in the chat. So we did get a couple questions, and you're welcome to raise your hand or add more questions in the chat as you think of them. But first, I'll invite all the panelists to turn on their video. And I'll ask my colleague to turn us, if you can go into gallery mode. Yeah, so my first question is kind of general, so anyone feel free to answer it. But can you sort of say why are schools important partners for engaging with refugee and immigrant communities, just more generally?
I'll start because Principal Beebe gave us a great overview, but also schools, especially in Clarkston, where you have a lot of language needs, psychosocial needs, you have socioeconomic barriers. The school has already been an institution that has taken measures to meet those needs with families. Again, like no other institution is or should be as trusted as a school. We know that especially in low socioeconomic settings, the schools are often showing up in health areas and social areas for better or worse. So that was one reason why, in order to get, after 6 months of the vaccine being available, when we're talking about communities that are still hesitant and the natural hesitancy about immunizing your children, we had to partner with the schools. When the school says that they support a public health initiative, people listen.
Yeah, also, and then just to add to Temple, so the school is very important because, as a former refugee, I'd come through this process. So the first trusted resource for the family is their kids from the school, because they speak the language and it's very easy to reach to all the families, especially the older people that they don't speak the language. So that's a very important, because they will ask their kids for interpretation to translate any information. Thank you.
And I would also like to add that we included our staff members as well as a part. So our staff members were present, and some of our students and families were able to, they did not feel isolated in the effort. So it was all of us there participating.
I can imagine for a child especially, but maybe for a parent who might be nervous, having the teacher there or school staff, a familiar face, the family liaison, would be a really sort of calming presence in that moment. So I love to hear that you involved them. Suad, did you have anything to add?
Yes, I did actually. I think during the pandemic, we often forget how much kids have actually gone through, right? Like missing school, learning, being around other kids, and just sort of being in that healthy environment. So I think targeting schools was honestly just a no-brainer because we really wanted kids to be safe and sort of to feel that sense of normalcy. And I think for someone like me having kids, that was like my number one target, was to really target the schools.
Absolutely. That's so important. Thank you for adding that. We had a question from Karen Wynn in the audience that she was wondering, it sounds like obviously school partnerships are really valuable, but how do you really build that partnership initially? Like, did you, perhaps Omar, did you go to the school district first, talk to the principal first? Like, how did this really come about?
So actually, this idea is like when we start response to the pandemic, when we start the testing, and we were like talking about the school, and at that time the school was like online virtual, and then we brought this idea to the coalition and we discussed that with all the CBOs, and then we decided to have a letter signed from all the CBOs, all the resettlement agency who works in that area, and we send it to the principal. So the process in our county is different. So Principal BB was our, as I called her, our champion, because she got that letter and then she submit the request to the district, and then she got the approval from the district, and then she came back to us, and we already have the approval from the Board of Health. So it's like team efforts, but to be honest, the principal is the key of success.
Yes, I know that all too well. Suad?
Yeah, no, I was just gonna also add, I think honestly, the key to this whole success is being able to partner. Don't try to do it all on your own, because sometimes you're not going to get the response that you need. Partnering with other CBOs, they have connections as well that you're able to sort of tap into. But at the end of the day, everyone loves a good theme and a good giveaway. So I think just the fact that we had this idea of making it a fun sort of event and a place where kids can sort of walk in and get excited about the volunteers dressed in costume. I mean, I just, most likely if you have a great theme, everyone's going to be on board.
Yeah, that's so true. That's so true. And I love how a few of you talked about kind of like getting together in numbers. And so maybe you don't already have a relationship with the school district, but maybe there's other CBOs, community-based organizations that do, writing a joint letter, having a lot of people sort of get in on the advocacy for this could really be helpful. Do you know, and this might be a question for Principal Beebe, Diana Newhart is asking, do you know what the vaccination rates are for your students, for your parents, and for the teachers? Like how do you know that these efforts have been successful? I mean, you've had 1,000 vaccinations, obviously, but like, what are the rates like in your sort of school community?
So thus far, we have about 600 vaccinations, and we're slated to have about 1,000. That's within the families, not just our students. But I do know that more than 90% of our faculty has received at least 2 vaccinations. That is all important, because if you can just consider as a leader, we were bringing children. There was a lot of fear with our staff, a lot of fear. And we had to, as a leader, I had to think of what can I do to kind of ease the minds of not only the parents who were hesitant to send their children to school, but the teachers who will be sitting in classrooms with 20, 25 students where some of those homes had sick people. So what we did is we figured we can only battle it with the research, and the research is the more people that you have that are vaccinated, the less likely you are to have very serious illness. So that helped, and to be honest, we've done a great job. There are several other protocols that we've established inside the school. For example, half of our students eat in the classroom. We have a staggered lunch day. We had to change a few other, of course, the regular social distancing items, but we had less COVID reported cases once we began to vaccinate. And that was one way that I knew we had less children out and less people reporting that they had positive COVID cases in their home.
Okay, that's really good to know. I've seen this question a couple different ways, and I knew that it was going to come up. So some folks are wondering about funding, both for the event itself, obviously, but also the incentives for families. Like, I'm hearing you that the incentives basically is about not necessarily incentivizing, but about removing a barrier. If they need to take time off work, if they need to arrange for childcare, if they need to pay for transportation. And so that's obviously really important, but where does the funding come from to really help families access that?
I'm happy to answer that. So one incentive was the $100 gift card, which came from the American Recovery Plan funds that were given to Dekalb County commissioners. So that existed in its own entity where they were able to come to vaccine events and offer that. And we worked really closely with Dekalb County representatives to be able to do that. Other funds, we really saw before our health fairs and our initial school events that all of us were pooling together funds we had in order to make it happen. This was a pilot project where someone from Emory University had a bunch of masks, and Georgia State was able to get a bunch of things for the gift bags, and we were able to fund the staff that we had to show up on these Saturday events. Then we were able to look to other grant sources so that, there was other entities that had funding to support vaccine confidence. We had support from commissioners in order to do this. We had support from Georgia State's CDC funding, as well as Refugee Women's Network. So it was different areas that we were pulling from in order to do it. And we really did have to start small. And, we started with saying, okay, we're just having the vaccine and our, the most needed partners. And then at the second and now third events, we've been able to give water and refreshments, include more partners, and even now growing to even being able to provide blood pressure and diabetes screenings. But that is, again, the collaboration and pooling of resources. So it's not just one big fund putting this on, it's everybody bringing their bits.
I can see then why, having group partnerships with a lot of different CBOs, a lot of different organizations, health departments, schools, that's going to be super important. I heard, I'm just going to go back a little bit. I heard from Omar and Stephanie and basically everyone that Principal BP is a champion, right? And it's you want to do this, you got to start with the principal. Principals hold the key, and I totally get that. I worked in schools for 10 years, and that's totally true. But did you all also how involved were your school health services, school nurses? That sort of aspect of your either school staff or at the district level in creating or managing this event?
Well, I will add that we didn't have a school nurse at the time.
I know that's a thing.
Yeah, we didn't have a school nurse. The district had about 30 vacancies, so I was the school nurse. So with that, we did have our local, and the process for me started with our district's nurse. And so I was the one basically without a nurse stating, these are the things that I'm seeing. Where can we get support? And at that time, to be honest, there was just very little personnel in any department, because I'm sure all of us saw, limited people were sick or they just didn't come back to work. So with that, I had to just be resourceful, and we received most of our guidance from the district level, not the school nurses. But school nurses have always been involved in our processes from the district in reporting and identification and in educating. I just didn't happen to have a nurse at that time.
I think a lot of people don't realize that not all schools have nurses. Like they because I think maybe it was more common in the past, but some schools, they might share a nurse with another school, so the nurse is only there 1 or 2 days a week, or they might have like district level, in your case, district level nurses who kind of advise or provide leadership. I would imagine though, this was a question from the chat about like the involvement of school nurses. I would imagine that if you did have a school nurse, she or he is probably not going to jump on doing this event unless the principal gives the blessing. She's going to bring that idea to the principal and say, what do you think of this? And they're going to work together. And so I would still say, just based on like my experience in schools, still going through the principal is probably the way to go. So this is a question kind of for everybody. Can you speak to your biggest challenges or obstacles for someone, like what advice would you give to somebody who wants to do a similar event? Like, what do you want to make sure they watch out for?
Okay, I'll say something. I think that we do have really sort of resistant communities, right? And I think one of the things that really helped us, and we didn't just go to the school the first day and set up everything and say, hey, we're giving vaccines away. We first started out by just showing up, giving people flyers in different languages, making sure that everybody that's there is culturally and linguistically appropriate to sort of assist the families at the school, and just kind of talk to them generally to get an idea of what their fears and concerns may be, and to also get them, I guess, familiar with us, so that when they see us next time, they know what our initiative is and why we're there. So I think we kind of started out at that. So I would definitely say that, if you are experiencing some, big obstacles, don't start off with just trying to get people vaccinated. Just talk and listen, find out what their concerns are, and find out how you can help them.
Also, I just want to add one thing. Actually, the NRCRM resource was very good resource, especially like we have a process to request any information. So usually the ambassador, the health worker from all the organizations, when they are attending events, they're getting the questions from the community and the feedback, and then we send it to NRCRM, and then they send it back to us within different languages. Especially at the beginning, there's a lot of hesitancy about the DNA, about the fertility, there's too many questions from the community. So reaching this community with the proper language, and so I'd say we are like visible in the community. So it was easy to reach to them and answer all the questions, because our goal in the coalition to normalize the process, not to force the people. Like, this is the trusted resources. Please, if you have any question, you can ask us. Thank you.
Okay, so what I'm hearing from Suad and Omar is like definitely trusted messengers and taking the time to build that trust, doing sort of vaccine education ahead of the event, not just showing up with vaccines, and then making sure that you're having materials that are culturally and linguistically relevant, as well as, and Principal Beebe spoke to this earlier, like to interpreters, family liaisons at the event. Is there any other advice you would give to somebody who wanted to host something like this?
I think, again, just showing those communities that you are interested in their well-being overall. You're not trying to meet a quota. That's why finding community-based organizations, whether it's academic or religious or community leaders that have an invested interest in that community, is really important, because you're trying to create trust And so yes, making sure you're finding those leaders with the good intentions.
And if I could, I don't want to paint a picture that this was something that was not met with challenges. The first few conversations that we had were full of, I was worried, I was afraid. I did not know exactly how my district would respond. I did not know how my staff would respond. And honestly, it was a place where I really believe that a higher power put all of the things in place at the right time, where everyone was ready to accept and receive an understanding that we must do something, but I couldn't do it alone. So even though you may be met with challenges, I've just learned that no sometimes may mean a little bit later. So I didn't take the no a few times, and I began to just ask other questions. And I used my resources to empower my staff, my community, and my district with the appropriate information so that we could work in a way that was helpful and that, I have something, my name is on the dotted line too, and I like my job. So I wanted to ensure that we were just diligent in the practices, and so that we could have I don't believe in starting with just one thing. I wanted a sustainable relationship. And now they're my family. So it all worked out.
And I just want to add also, one of the beauty about all of this is that as you continue to do events, and I think even when you start to maybe have your first event or your second event and it doesn't go according to plan, you're able to recognize that I think for us, we were able to recognize that some ethnic groups were just not coming to get vaccinated. And that sort of made us brainstorm and think, okay, what is the best way we can, target these communities, and then reaching out to the leaders, like we mentioned before, and even having vaccine events at apartments, which we've actually done, and they've turned out to be great. We actually vaccinated 100 people, which I'm still sort of surprised, I'm surprised by that because I didn't expect that much of a turnout, but so don't get discouraged. I think the most important thing is just keep going. Ultimately what you're doing is for a good cause.
It's really inspiring and it's really amazing. I'm already like a huge sucker for schools. I believe so much in public education, and it's like you're really doing work that's literally saving lives. And so I just want to like take a moment and just like sit on that, because as you said, it's challenging and it wasn't easy, especially the first couple of events, but oh my gosh, like how important is this? Kids can't learn if they're sick, right? And like these public health and public education really work so well together. But I have another question. I have a million questions, but like anyone in the audience, feel free to add questions in the chat and I'll get to them, but I could like talk to these folks all day long. My question is like, I know Principal Beebe, you have, I think 2 more events coming between now and the end of the school year.
I have one on May 7th, and we're in the process of requesting a final one in June.
Okay. So I feel like, I don't know about y'all, but I'm in a place right now where like, I find that people are they have like pandemic fatigue. They're sick of talking about COVID. If they haven't gotten their vaccines by now, it's like, I don't even want to talk about it, that sort of thing. So do you have any recommendations for making sure your COVID-19 vaccine efforts are relevant at a time where like people are ready to check out?
Well, school-wide, we still have, because, you get 1 or 2 kids that we still have testing that comes in the school once a week. And now, just as you stated, that has kind of fallen off. But we still have protocols. So as long as we have the protocols, we know that it's an issue in the schoolhouse. So we remind, and now the masks have come off. That's a big deal. Because previously, you had at least some type of barrier that even made us feel better. But once that barrier goes away, we're still reminded that it's still a highly transmissible, and in that setting where you have so many people, and it's a very densely populated area. And I forgot to share with everyone, out of the 900 kids, I only have one school bus. One school bus. So my children walk to school. Most of my children walk. On that school bus, it's less than 65 kids. And when our parents come, they don't come alone. They bring all the babies and the aunts and the grandmoms. So on my campus, every single day in one area on my campus, I have almost 1,500 people every day. So because of that, and for that reason, as the leader, I have to share, I have to continue to work with this coalition to inform our communities, to ensure that our parents know that if you haven't, hey, your baby's at home soon, they'll be able to get their shots because they're little, and we want everybody in the house safe. So, and they listen. So we don't take it for granted. We really want as many people to be healthy, to be informed, and it has also brought about questions in the screenings. So, and screenings and other healthcare options. So the coalition is working on screenings, and at our next event, we're even talking about, we're bringing in other efforts like healthcare and childcare, like true childcare issues. So it goes beyond, and I can't do it alone. I had to find this group. It fell in my lap. It really did. And now I'm there at as much as I can. We're asking those questions and they are delivering. So another piece of that is find a group that loves your community. Find a group that has the same will and interest in your community. And I'm talking about, sometimes we're on the phone on a Friday at 6 o'clock. Love. So if they don't love kids, if they don't love your community, they're probably not your best partner.
That's awesome. I love that. There's so much love. Oh, is there, so one thing that I heard, I'll just kind of, we're talking about relevance, right? A lot of people have pandemic fatigue right now, and how do you stay relevant? And one thing that you said that I want to make sure that people didn't miss is, like, you're doing things like blood pressure screenings, you're doing things like childcare and having other resources at these events. So it's like, fine, you don't want to get your vaccine, that's okay. Just come here and we'll check your blood pressure. And it's a way to kind of have that conversation. And it's a way to sort of build that relationship. Do the other panelists have anything they want to say about staying relevant during pandemic fatigue?
I think there's an element of, normalizing the vaccine at different community engagement events so that there was less stigma. We also have this approach when we talk about mental health, in these communities where we know mental health is an issue, but we need to carefully approach it. Normalizing those conversations at health fairs, and we have Center for Victims of Torture that comes to support a lot of our events, and just the idea of, like Suad said, show up for the conversations, ask the questions, keep relevant by being responsive and not making assumptions about what communities need. It has to be around dialogue.
Absolutely. Absolutely. I saw Suad, you came off mute. Did you have anything to add?
No, I was just going to say, another sort of additional service that we hopefully want to be able to add is just the back to school, and being able to get kids that are coming back to school, get those additional vaccines, right? And offer that. So I think we have about 2 back to school events that we're sort of planning. But again, just constantly trying to address some of those concerns, and like Temple said, just normalize it, really.
Yeah, that's a really good point, and that's a perfect way for us to close up. We're just about out of time. This is a really great conversation, but the thing that I want to flag for people that are on the call is that back to school planning started like yesterday. Like, school people know this. Like, you start planning back to school in like February. So if you're sitting there, if you're like from a health department organization and you're saying like, oh, I don't know if we have time to do it before the end of the school year, that's okay. That's totally okay, because like August is going to come up like that. So I will leave you with that. It is never too late to start this partnership, and it's never too late to get this going. Plan your back to school events. Look for an email from me. I'll be sending you links to all the stuff that we just talked about. And thank you so much for your time.
Thank you, Sarita.
Thank you.
Thanks.
And we'll be in
Yeah.
Cleveland.
Yes.
Thank you.
We will.
Thank you.
Bye-bye.
Bye-bye.
Thank you.